Thank you, Brianna. And thank you to all of you for joining us today for our webinar on building health and resilience by teaching mindful eating and feeding practices to rural parents of young children. My name is Dawn Contreras. I'm a senior extension specialist in the Health and Nutrition Institute at the other MSU, which is Michigan State University Extension. My main interests are in the area of promoting health and well-being among individuals and families. So I have some current projects that include initiatives in the areas of rural health and resiliency, substance misuse prevention in rural communities, a sleep education for everyone project, falls prevention education, and promoting immunizations across the lifespan. I'm going to be presenting today along with my colleague, Holly Tiret. And Holly, I'm going to turn it over to you to go ahead and introduce yourself.
Thanks, Dawn. So I'm Holly Tiret, and I'm a senior extension educator with MSU Extension within the Health and Nutrition Institute. And my areas of expertise are in social emotional health. I teach classes in a variety of topics around mindfulness and anger management and powerful tools for caregivers. I just learned how to do the sleep training, but I haven't done that yet. So, and that's about it.
Thank you, Holly. We'll go ahead and pull up our slides now and move to the slide that shows our agenda for today. During this webinar, we're going to briefly talk about a recent study that showed rural-urban differences in obesity among young children, specifically preschoolers. We'll also talk about the role emotional overeating might play in obesity among preschoolers that we found in this study. And we'll be going into more detail on mindful eating and feeding strategies that might help build health and resilience amongst young children. Next slide, please. Perfect. So childhood obesity, as you're probably aware, is a significant public health issue in the United States. And researchers show that rates of overweight and obesity tend to be higher in rural areas than in urban areas. Now, while previous research has found conclusive and consistent differences in weight between rural and urban school-aged children, what was unclear in the literature was whether those differences were found between rural and urban children as young as preschoolers or younger. Next slide, please. So to learn more about this topic, we did a study of the body mass index, or BMI, of 572 preschoolers that were ages 3 to 4 years who attended Head Start preschool programs in both rural and urban Michigan counties. BMI, as you probably are aware, is a common measure of weight category, which helps to determine if the person is underweight, healthy weight, overweight, or obese. In this study, 48%, or 273 of the preschoolers were from rural areas. 52%, or 299 of the preschoolers were from urban areas. Roughly half of the children were male. 59% of the parents were non-Hispanic whites, 29% were African American, and 7% were Hispanic, Latino, or other. 43% of our sample were single parents, and 48% of our sample had a high school diploma or less as their highest level of education. In this study, we not only compared BMI scores between the two groups, but also possible predictors of BMI results. We looked at things like dietary quality, which was determined by 3 24-hour dietary recalls. We looked at amount of physical activity measured in minutes per week, amount of screen time measured in hours per day, and obesity promoting eating behaviors. The obesity promoting eating behaviors were measured by a 34-item questionnaire that was completed by the parents. Categories in that questionnaire included such topics as their child's responsiveness to food. For example, an item was always asking for it. Their enjoyment of food, their slowness in eating, and their degree of emotional overeating. An example of an emotional overeating item was, my child eats more when worried. All of the items were rated on a 5-point Likert scale, from 1 meaning never doing this behavior to 5 always doing the behavior. Next slide, please. The main findings of the study were that rural preschoolers showed higher BMI rates, they participated in more physical activity, and they demonstrated more emotional overeating behaviors than urban preschoolers. We didn't find any differences in dietary quality or amounts of screen time between the two groups. Next slide, please. Since emotional overeating is an obesity-promoting eating behavior that's known to be associated with higher BMI rates, it's important to consider why rural children as young as 3 to 4 years of age might engage in emotional overeating and what can be done about it. Next slide, please. So we are so glad that you're here today to consider these questions with us. As you might know, the rural environment can be filled with stressors, such as higher poverty rates, increased isolation, and a possible lack of access to products and services for things like affordable healthy foods or the provision of adequate family support services when times get tough. Next slide, please. So in Michigan, we have considered that rural children this young might be taking on these adverse eating behaviors as a result of trying to cope with the stressors in their lives. Similarly, rural parents and caregivers might be either modeling or using feeding practices that teach self-soothing or self-medication through food consumption. So in response to these possibilities, Michigan State University Extension has been delivering several mindful eating and feeding programs that we're excited to tell you about today. Through these mindful eating and feeding programs, we hope to be able to build health and resilience among our youngest children. So I'm going to turn it over to Holly Tiret right now to tell you a little bit more about these programs. Thank you, Holly.
Thanks, Dawn. So research has shown that practicing mindfulness is effective in reducing stress-related symptoms such as worry, depression, physical tension, and maybe helpful in managing chronic conditions such as cardiac disease and diabetes. As a result of MSU Extension's mindfulness programming, individuals and families across the state and beyond have learned positive strategies to deal with stress. Supporting emotional and social development increases their protective factors to health risks, increases their resilience, and contributes to positive overall outcomes for both families and society at large. Like many others, since the beginning of the pandemic, we have moved the majority of our classes to online using an online Zoom platform. This allowed us to reach a broader audience across the state and elsewhere, both in urban and rural areas. Our classes in mindfulness have become very popular as people are searching for ways to deal with ongoing stress. During 2020, our team taught 40 series, that's 5 weekly lessons of mindfulness with 761 participants. In addition, we presented 153 one-time mindfulness-related workshops with over 7,000 participants. After attending an MSU Extension mindfulness class, 91% of people felt highly confident that they could recognize behaviors that make them resilient to stress. 90% of people felt highly confident they understood how the brain works under stress. 92% of people said that they understood the power of gratitude to relieve stress. Next slide. Okay, so Mindfulness for Better Living is a suite of mindfulness-related workshops developed by MSU Extension Health Work Team as a way to incorporate mindfulness concepts and practice into everyday life. Each workshop is 1 to 1.5 hours and can be taught in person or online. Workshops include mindfulness for parents and caregivers, relaxed alternatives to anger for parents and caregivers, mindful educators, maintaining health during challenging times, caring for the caregiver, the importance of adult-sibling relationships in your caregiving journey, changing negative self-talk, teaching kids mindful eating, and mindfully feeding infants and toddlers. Next slide. In an effort to teach concepts of mindfulness related to eating and feeding, we focus on 3 workshops. Mindful Eating Lesson 2 from West Virginia Extension's Stress Less with Mindfulness, Teaching Kids Mindful Eating, and Mindfully Feeding Infants and Toddlers. And I'll go over each one of those separately. Stress Less with Mindfulness is a 5-class series for adults that introduces mindfulness concepts and practices to reduce stress-related symptoms. Provided in collaboration with West Virginia University Extension, Stress Less with Mindfulness introduces participants to the experience and practice of mindfulness with the goal of reducing stress. Mindfulness can be defined as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. The 5 lessons included with Stress Less with Mindfulness are begin with a breath, mindful eating, mindful walking, be kind to your mind, and laughter is the best medicine. The curriculum is copyrighted, so I put the purchase information there on the slide if you're interested in contacting West Virginia for that curriculum. Next slide, please. So one of the lessons we teach is mindful eating. It's a workshop geared toward any adult who's interested in improving their own healthy eating. It can be taught in person or online and is 1 to 1.5 hours. And the concepts are learning the benefits of eating with mindfulness, creating a personal hunger fullness scale, and experience mindful eating. The next slide. The second program I mentioned that we do is teaching kids mindful eating. And this is adapted with permission from West Virginia Extension and authored by Michigan State University Extension. This workshop is for any adult who lives or cares for children ages 2 to 5. It can be taught in person or online, and it's 1 to 1.5 hours. The objectives of this workshop are to learn the benefits of eating with mindful awareness, learn ways to help children be more aware while eating, and increase the awareness of portion sizes for children, and learn about confident eating and also experience mindful eating. Next slide. Mindfully Feeding Infants and Toddlers is a workshop authored by MSU Extension based on research done in collaboration with Nestle Gerber Research and Development. In 2017, MSU Extension collaborated with Nestle Gerber R&D to look at the potential relationship between parenting styles, picky eaters, and mindfulness. Based on their results, they concluded that coached parenting styles were significantly related to more frequent mindfulness behaviors. In addition, they suggested that increasing a parent's level of mindfulness behaviors may positively impact health outcomes related to a child's diet and weight. Next slide, please. This workshop can be taught online or in person and is 1 to 1.5 hours. It includes video vignettes featuring Extension staff and their own children, modeling some of the mindful feeding practices discussed in the lesson. During this workshop, we talk about how mindfulness, parenting style, child temperament can all work together to help children develop a healthy relationship with food through responsive caregiving. So the objectives are to define and discuss mindfulness related to parents, caregivers, and children, learn about parenting styles as related to feeding styles, explore parent-caregiver temperament and child temperament styles, and learn techniques to incorporate mindfulness into everyday feeding practices with children from birth through 3. Next slide. During our workshops, we provide links to further learning and practicing mindfulness. One in particular is our virtual calming room, which includes videos, audios, and ideas for incorporating mindfulness into everyday life. I've included the link on this slide. Please visit it and enjoy and share. In summary, MSU Extension has found a high need for these programs amongst our rural families, in particular, on providing an online format for learning and connecting with others. And we'd like to thank you for inviting us to share our research and programs with you today. And we are excited to learn about what you are doing in your state.